Good afternoon. Welcome to Lunch with Lisa. We are just getting to the end of our 7th week. This has been a really special week for me. This has been in honor of my dad, who's been battling cancer. And today we have a really special guest. We have Dr. Laurie Glimcher, the president and CEO of Dana-Farber. And our goal today is to share with you all of the amazing work that Dana-Farber has done for their patients and families during this time, and also share with you sort of what it's like to be on the other side of the pandemic when cancer hasn't stopped, and what it's like to be a family member that is communicating with a loved one over Zoom. And we really encourage people who are watching today to chat on the chat, ask questions, and also share with one another maybe their stories. And additionally, we have had a sponsorship campaign this week, of which we've raised $16,000 already. Bob and I contributed $1,000 ourselves. We encourage other people to also, oh, there we are. Thanks to my team for posting that up. Michael and Heather Bajulian, Bullfinch, Calare Properties, Callahan Construction, CBT Architects, Cabot and Forbes, Commodore Builders, Kramer Advisory Group, Crosspoint, Design Farm Architects, the Goodale Company Insurance, High Point, Janitronics Building Services, the Richmond Company, and Sasaki were all $1,000 sponsors. So thank you to all of them for that. And while $1,000 isn't always in everybody's budget, while you're watching today, if you are encouraged or inspired, think about a $73 donation, because my dad turned 73 yesterday. That's why we took this week to honor him and all cancer patients and people that are battling something other than COVID-19. And so maybe $73 is something that you could donate. And we put the donation link up there. We just ask that at the bottom when it says why, if you type Nickerson, it helps us just keep track of how many donations came through this campaign. So with that intro, Dr. Glimcher, you are the CEO and president of Dana-Farber Cancer Institute, director of Dana-Farber Harvard Cancer Center, and the Richard and Susan Smith Professor of Medicine at Harvard Medical School. You are a very distinguished immunologist and widely renowned for your work in one of the most promising areas of cancer research, and also a strong supporter of women in science and medicine. And I'm so thankful to have you here today. So
delighted to be here, Lisa. Thank you so much. And before we start, I just wanted to ask you how your dad is doing.
Well, my dad is doing much better than we even expected. So, as you know, he was diagnosed in January and he's in palliative care. And honestly, they thought that he would tolerate 2, maybe 4 chemo treatments. And I'm excited to announce he just did his 5th this week. So it was, again, I feel like a lot to celebrate at his birthday yesterday, that he's doing well and that his doctors and his nurses are working so closely with him on every little issue or problem or challenge. And so far, we would think that maybe that challenge was related to chemo and it was something else. Or maybe there was another thing he didn't feel well, and they just keep working through it with him. And so he's actually doing well. So thank you for asking.
It's great to hear. That's great.
So there's been a lot going on at the hospital, obviously, outside of what you do in every day. But can you share with people some of what you've needed to do during the pandemic to keep your patients safe and to continue to provide the same level of care?
So as you and the audience probably know, people that are susceptible to COVID-19 tend to be older or to have comorbidities. And one of those comorbidities is certainly cancer, because patients with cancer do have weakened immune systems. Mm-hmm. So their ability to fight off successfully the COVID-19 virus is less good than other individuals who don't have those comorbidities. So we've taken extra care to make sure that the patients that come in to see us are protected. Mm-hmm. And part of that, of course, is the personal protective equipment that we and other hospitals have worked very, very hard to obtain. It's very competitive, actually. There isn't enough protective equipment out there, but we've done quite well with that. And actually, as we've done some contact tracing, we have not found any cases to date of patients who acquired COVID-19 from their caregivers. You know, cancer doesn't wait just because we're in a pandemic.
Right.
And we have many, many cancer patients who come to us every day who need to get their treatments, their chemotherapy or their immunotherapy.
Mm-hmm.
Our nurses and doctors and healthcare administrators have done just an unbelievable job taking care of those patients. I've gotten a lot of positive comments back from patients about how safe they feel and how grateful they are for the kind of care they're getting at Dana-Farber. But that's Dana-Farber's culture. I mean, we have a 97% satisfaction score with our patients, and I'm very proud of that.
I remember the first time my dad went to Dana-Farber, he said it wasn't like being in a regular hospital. He felt like it wasn't scary, and it's a scary thing to do, to go to Dana-Farber for the first time. And he just said he felt so safe and protected and in the best place he could be. And for family who has just gotten this news, that made us feel so much better because we were just as scared and we didn't know what to expect. So it's a special place that you've created. Somebody on the side was just asking, I'm going to jump into this quick question. Is the PMC going to happen this summer? And if teams aren't raising money, how can they raise money?
Well, that's a great question. And I think Billy Starr, who founded the PMC and is still just roaring ahead, is just a fantastic and wonderful human being. Mm-hmm. The PMC is not going to happen in person. That would be really not fair to the huge, over 6,000 bikers that come and volunteers. And we feel that is just too risky. Mm-hmm. But there will be a virtual remote PMC. And we're very much hoping that the individuals who have supported the PMC last year, when we raised $65 million, will support it again this year, because as I've said before, and we'll say again, cancer doesn't wait and neither can we. And there's so much we have to do. Mm-hmm. Those funds allow us to do the groundbreaking research that goes on every day at Dana-Farber to come up with new treatments for cancer.
And you've continued that through the pandemic. Again, this hasn't stopped.
Well, what we've done is to move our researchers remotely for the last 2 months, yep. Keeping them busy at home with writing papers, writing grant applications, having lab meetings. And we're getting ready now next week to start bringing them back now that it's safe. Because, we have to put safety for our employees, our doctors, our nurses, our researchers, our scientists, our clinicians, that has to come first, and of course our patients. So we believe now that the peak has been reached and is slowly declining, following Governor Baker's suggestions of a 4-phase return to work, that we will have our researchers back in the lab very shortly.
And what does that look like? I mean, that's the big question this week, is what does going back to work look like? But what does that look like for Dana-Farber? Does that change how your patients come in and out, or what would people expect?
Well, we've already set up a very robust system and process for patients who come in. They can only come in through the front door of the Dana building, and then they are asked about potential symptoms, et cetera, et cetera. Everybody wears a mask, both our caregivers and the patients.
Sure.
As you know, we've put policies in place to protect as much as we can, and that means that, as you well know, that visitors cannot accompany, or family members cannot accompany the patient.
Right.
You know how difficult that has been. There are a couple of exceptions to that. If a patient is cognitively impaired, or the patient is a child, obviously an adult can come with them.
Right.
But that we don't want to expose anybody to COVID-19 unnecessarily.
Sure.
It extends to obviously no visitors, and hopefully those will be relaxed gradually as we gradually come back to a new normal.
Have people been understanding of that? I'm sure that's very hard for people. How do how have you managed that?
I think people really have understood. I've been amazed and inspired, not
Hmm.
only by our healthcare workers, but by our patients.
Hmm.
They get it. They know that we're doing this for their safety
Sure.
and the safety of our healthcare workers, because if we have to quarantine too many healthcare workers, then we're not going to have enough nurses and doctors to take care of our patients.
Right.
It's just vitally important for everybody. And, I think that across the Commonwealth,
Hmm.
people are being very understanding about this. There are some exceptions,
Hmm.
but and I think we all want to prevent another surge of the coronavirus, a
Hmm.
relapse, because ultimately that will lead, as Dr. Tony Fauci says, to going backwards to where we were 2 months ago and will delay recovery.
This next question could keep us on the rest of the afternoon, but I'm going to ask it for the quick answer. So it's real. I think there's a lot of people feel like we need to get back and we need to get our economy back on track, and we don't really need to have all these safety precautions. And so you're telling us this is real, that we need to be so very careful.
Yes. Yes. We need to follow the guidelines that Governor Baker has set out.
Hmm.
Industries will differ in how soon they can come back. I wouldn't recommend anybody going to a movie theater
Hmm.
or sports event, obviously.
And to also think about, a lot of people say, well, I don't have a weakened immune system. My family members don't, but you could be around somebody like my dad who is battling cancer, and you may not even know that. And you're sharing it with other people. And so I think that having people be empathetic for all of the people around them that may be compromised. I have asthma. Most of the world may not know that. I don't walk around with an inhaler in my hand, but that makes me more compromised. And so, again, everybody needs to think about not just themselves and their immediate family, but everybody they may come in contact with.
I think everybody needs to take care of everyone else. We need to take care of each other. That's
Mhm.
what we do at Dana-Farber, and that's what we hope everybody in this country and other countries will do as well. Put other people first.
Mhm.
We do
Yeah.
that.
So,
And
yeah, and
I
that it can surge again. That this really can happen next winter.
think we can surge again. We could have a relapse of the current uh, pandemic
Mhm.
if we don't observe these important guidelines. And separate from that, the coronavirus could well come back in the late fall or early winter.
Mhm.
A vaccine, we're hoping, will be ready by a year from now.
Mhm.
Uh, luckily, there are 100 different companies or academic research labs who are working on a vaccine for the virus, and the more the better, because they're taking different approaches to disabling the virus.
Mhm.
And hopefully, a handful of those will work and be successful, because we're going to need a heck of a lot of vaccine doses.
Right.
Just for the United States, we would need at least 300 million, depending on how potent the vaccine was. And for the whole world, well, that you can imagine what that would be. So we're going to need several vaccines available, and we're going to need the manufacturing capacity. And I'm optimistic that we will get there.
That's good to hear. And I really appreciate you sharing with people how important it is that we are diligent in our safety still, and that this isn't just summertime, and that we can all go back out and that it's all okay. One of our questions on the side, and this touches me because my father has gastroesophageal cancer, uh, and it was the stomach cancer that is his biggest problem. For patients with rare cancers like stomach cancer, why is Dana-Farber the best hospital?
I think it comes down to the culture of Dana-Farber, because we always put patients first. And we have an array of incredible care folks, whether they're nurses or doctors. I mean, we try to surround every patient with a team and a family. And I'll tell you a little story. When I first arrived at Dana-Farber as the CEO, I was at a reception, and a woman came up to me and she said, "Are you Dr. Glimcher?" And I said, "Yes, I am." She said, "Well, I have a question to ask you." She said, I've just been told that my breast cancer has been cured, and I don't need to come back anymore for follow-up visits.
Mhm.
Do you think it would be okay if I did come back? Because I really miss my team. They were so wonderful, and they're like my family now. And I would just come back a few times. And I said, of course you can come back. Well, everybody would be thrilled to see you. I'll
Sure.
give you another example that just brings tear to my eyes. We had a young man who unfortunately had a very devastating cancer, and he was young, and he was going to die. He was not going to survive. And the nurses who took care of him said, well, what can we do that's special for you
Mhm.
in these last few weeks? And he said, well, I'm engaged, and I really wanted to take my fiance to an elegant dinner, but now I can't do that. And the nurses hired a limousine. One of their husbands was the chauffeur. They arranged everything with this elegant restaurant and a wonderful dinner. Of course, they had to go with quietly because he had, intravenous tubes in him.
Mhm.
And this was on their off time.
Right.
It was all paid for. And this young man was able to have an elegant dinner with his fiancée. And if that isn't devotion, I don't know what is.
Right. Right. My dad tells stories about his nurses touching base with him and making sure that all the little, like I said, all the little things are going well. And yeah, we're getting comments on the side, the wow and the wow. Another former patient of yours I know is on, and he commented that he loves the indoor garden and what he thinks is the fourth floor.
Yeah.
So,
Yeah.
so,
It's cool. Well, I was at an event with Congressman Joe Kennedy a couple of months ago, and he told me another story. He had been campaigning a couple of years before that and ran into an older gentleman, and he said, "How are you?" And the gentleman said, "Well, I'm really not too good. I have metastatic lung cancer, and I think it's over."
mhm.
And then Congressman Kennedy ran into him 2 years later, and he said, "Well, what are you still doing here?" And he said, "Dana-Farber, they do miracles."
Mhm.
And that's because our researchers have discovered over half of the new drugs for cancer in the last decade.
Mhm.
The quality of the research we do is amazing. We get more funding from the National Cancer Institute than any other cancer center in the country. We're the only cancer center that ranks in the top in both pediatric and adult oncology.
Mhm.
And our discoveries are cited in the press times more often than any other cancer center. So it's a combination, which I think is pretty unusual, with a absolutely superlative group of researchers who are coming up with new treatments for cancer, combined with just a marvelous, compassionate, devoted group of clinicians and nurses and healthcareers. And there's just no barrier between them. We go right from the bench to the bedside, and the bedside back to the bench. And I think that's pretty unique for a cancer center.
Yeah, absolutely. You know, part of well, when I first reached out to you about being on the webinar, we were talking about the fact that there are so many families like mine who are dealing with this right now. My dad is isolated with his wife at home. And well, a lot of people dropped things off for them yesterday, which was really kind. And he was super excited about it. He was showing me on his FaceTime last night a video of all the things that had been dropped off at the house yesterday. I want everybody to remember that we may know another family that's dealing with this right now. When we first found out, and when we found out the diagnosis in February, we immediately started talking about as a family all the things we wanted to do this spring together. And we had an Excel spreadsheet, and my father's an engineer, and he does a lot by a value matrix and in an Excel spreadsheet. So in my dad's way, I created an Excel spreadsheet of all the things my brother was talking about wanting to do, my dad, our kids, and then we would rank the number so we could figure out what the most important things were to the family to do. And that had been our plan this spring, was to do as many things as a family as we could. And then COVID happened. And so we have been talking to my dad through Zoom and through FaceTime, which was not at all what we had planned on doing. And so I just saw him last weekend for the first time, and he said he had a gift for me. And he gave me this bracelet, and it has all of my major accomplishments engraved around it in very little letters. I don't know how he had it done. And it says, "I'm proud of you, love, Dad." And he passed it to me, and I had to pick it up. And I just want people to imagine what this moment's like. And I have to say, "Thanks, Dad," from 6 feet away. Like we were sitting outside, and because I don't want to risk, what if I had COVID and I didn't know it or was carrying it? And so these are real moments for families, and they are taken away in the traditional sense, but we're all managing in the way that we can. And I just want to encourage everybody to think about their friends and colleagues who may have a family member with cancer or with Alzheimer's or with, our client of ours lost their father to Alzheimer's recently. And again, in an isolation situation. And they're managing through this in a very different way than normal, or we would hope or want. And, that's what I was hoping that this particular webinar and your being on helped people think about that. And maybe there's somebody else they could reach out to, or a little something they could drop off, or just, thinking about those family members and maybe how they're feeling right now. So
it makes me think of our nurses, Lisa, who are really the front line.
mm-hmm.
There they are working 12-hour shifts. They're devoted to taking care of the patient before their own health.
Mm-hmm.
They also have families and loved ones, and they can't always go back to those families. And they're the ones who sit with patients who are not doing well and provide comfort to them. And, they've got very heavy gear on, protective gear. It's warm in those rooms. They're sitting there with gowns and face shields and masks and holding patients' hands and giving them comfort hour after hour. And I can tell you that our nurses, we pay a lot of attention at Dana-Farber to making sure that we are doing all we can for the well-being of our nurses to keep them strong and resilient. And I am completely humbled by the work that they are doing. Mm-hmm. So if you know a nurse who's in the front lines here, please say thank you, because they are putting their own lives on the line as our doctors. One of my sons is a thoracic surgeon at Mass General, and he spent several weeks running the COVID-19 ICU, which of course exposed him a lot because almost all the patients were on ventilators. Mm-hmm. And he wasn't able to go home for close to a month to see his 2-year-old son and his partner. And, when I asked him about it, he said, "Well, I don't deserve any special credit for this." He said, "I'm a doctor. This is what I signed up for. Right. I'm just doing my job."
Mm-hmm. One of my best friends is an anesthesiologist at Beth Israel, and she said much the same thing. She was going home by herself and not spending time with her friends or boyfriend because she was with these very sick patients, sometimes hours at a time if she needed to stay with somebody, and she couldn't be around other people. But she was very matter of fact about it. Actually, she was on an earlier webinar talking about this. Very matter of fact, that was her job, and that's what she was there to do. And so that's a special person, and that's a special mindset during all of this.
My 2-year-old grandson, "Do you understand why Daddy can't be here with you?" And he said, "Dada, helping people," which really melted my heart.
Right. Well, absolutely. I have another shout out to the social workers and clinicians at Dana-Farber. They helped me immensely. Why I'm still here, somebody else on the side. And my dad just said that his nurses are absolutely the best, and he brought them fancy cupcakes yesterday because it was the least he thought he could do. So, well, I want to thank you again for coming. Is there anything that you want to leave our attendees? This has been a very quiet group on the side. Usually we have lots of commentary and questions, but I've got to believe that they're riveted by the conversation and the fact that you've joined us today. Is there anything else that you can share with us?
I would just like to emphasize to patients out there that we are here for you and we are ready for you to come back. Mm-hmm. because when you look at the preventive screening for cancer, mammograms, colonoscopies, and pap smears, those have been reduced by 94%. So there are a lot of people out there who have not gotten their preventive tests because they can't go to see their primary care docs. And I just, and there are patients who should be coming to see an oncologist who are very afraid because they're worried about being infected with COVID. And I just want to tell all those people, we will keep you safe. Don't hesitate to come in. We are here for you. We will always be here for you. And we want to take care of you. Cancer doesn't wait. We have continued our clinical trials in cancer. No other disease has been allowed, except COVID-19, has been allowed to continue clinical trials. But for our patients, sometimes their best option is being enrolled on a clinical trial. So we have kept those going. And we don't want people to be diagnosed with cancer later rather than earlier, because the earlier you're diagnosed, the better your chances are. So I just want to make it clear and make sure that people understand, don't be afraid to come in. It could put you in a less good position if you have cancer.
Right. And that these preventative measures are there to help and to not wait. I remember at Christmas, we were at my brother's for Christmas when my dad just said he was having a problem swallowing. And his doctor was trying to figure out what it was. He didn't know yet that it was cancer. And I just say to everybody, really advocate for yourself too, to get to the bottom of things. If there's something wrong, don't let it go and don't just wait. And especially during the pandemic, I think people have been waiting to call their doctors about a problem or an issue. And they think, well, it's not COVID. And so you're absolutely right that they need to feel safe to be seen and be treated. Judith Schleger added that Dana-Farber is a fabulous cancer center, but is led by an incredible woman, Dr. Glimcher. So from Judy, and high risk genetics and prevention clinic at Dana-Farber can help stave off cancer. So
yes, we have an cancer early detection, high risk people who have either had behavioral lifestyles such as smoking tobacco that are at higher risk, or who have a family history of cancer. 10% of cancers are inherited, and we are looking for all those patients, whether it's the BRCA1 gene in breast cancer and ovarian cancer, which is 1 out of every 40 Ashkenazi Jewish women. We're testing all Ashkenazi Jewish women at Dana-Farber.
Wow.
Come in and get tested to see if you have the BRCA1 gene, because it's good to know. We can do something about that.
Absolutely. This has been great. Again, thank you so much. I want to thank again all of my sponsors who sponsored this week with, again, $1,000 sponsorship. I look forward to finding out from Dana-Farber how many additional individual sponsorships that we have received. But again, at last count, we were just over 16,000. So I hope that is helpful to your group and to all that you're doing. And I know that fundraising is tough right now during COVID, that your general fundraisers aren't happening, and the normal flow of funds may not be coming in from people because they're focused in other areas. So I hope that our contribution is helpful to you. And I look forward to being a supporter for a very long time. You have me and my team now as an extra resource. So
very grateful to you, Lisa. And every penny of those funds is going to be put to great use. I promise you that. So thanks to everybody who's listened in, and we so much appreciate your kindness and your support. Thanks again.
Yep. Thank you. And I hope everybody tunes in tomorrow. On a lighter note, we do have our Entertainment Friday, and we have a fabulous country music artist who's originally from Boston, and he will also be fundraising, though, for Beth Israel on that one. That's his hospital, but he said, hey, I'm going to jump on the fundraising bandwagon, and he will be fundraising for Beth Israel tomorrow. So, but we have to take care of all of our hospitals and all of our medical professionals. So I hope people can tune in tomorrow. Thank you so much, everyone, for being a part of this week, and we'll talk to you soon.
Bye, everybody. Thank you, Lisa.